Welcome, everyone. I want to thank our fabulous panelists for being with us today and everyone in the audience. Raise your hand because I want to applaud you for your courage, your fortitude, your commitment, and sacrifices that it takes to be a health transformer and an entrepreneur. So let's see how many people in the audience. Yeah, many of you. Thank you. Well, when I tell people what I do for a living, they often cringe, and then they say to me, I could never do that. But I love what I do, and I've been involved in fundraising for the past 20 years. And I joined StartUp Health last fall because I believe in their mission to improve the health of every person on the planet. And my role is to facilitate the funding of every Moonshot and of Health Transformer University. Money is the fuel to help us achieve our mission. When I was interviewing at StartUp Health, I learned about our philosophical underpinnings, one being batteries included, and that means not only coming with your batteries included personally, but fully charged. And then another philosophical underpinning that permeates every aspect of the company from day one, 12 years ago, is a transformational mindset. And it's that transformational mindset that helps entrepreneurs make it through the roller coaster of founding, growing, and having your company thrive. Today, these four CEOs are going to share with us their insights, experiences, and wisdom about transformational mindsets. So please join me in welcoming Chris O'Brien, CEO and founder of AdhereTech. Chris, would you raise your hand? There's Chris. Okay. Mark Clermont, CEO of Cecelia Health. Jeff Glueck, CEO and founder of Salvo Health. And we all know Wendy Powell, the CEO and founder of MUTU Systems. So let's get to know our panelists a little bit better. I'm going to ask each of them to share some interesting personal fact about themselves that is not in their LinkedIn profile.
Hi, everyone. I'm Jeff Glueck. I'm CEO of Salvo Health. And you'd have to really squint to see it in my LinkedIn profile. But if you've ever seen the Travelocity gnome, I created him. So I launched him, and if you've ever seen Amazing Race, or so that is but now that I'm in healthcare, I'm hoping to do something more meaningful with my life. But there you go. I'm the father of the gnome.
That's impressive, Jeff. That's a good one. Hi, I'm Mark Clermont, CEO of Cecelia Health. I spent the first 10 years of my life living in the third most remote island in the Aleutian chain in Alaska, which had a population of about 250 people. So that's a very far cry from the number of people we see here. So that's my story.
Thank you.
Thanks. Hi, I'm Wendy Powell from MUTU System. I live in the UK in quite a remote area down in the southwest, and I'm one of those crazy people that actually swims in the sea at the dead of winter. Even my dogs won't come in with me, but yeah, so that's something I do. I don't know why I do it, but it feels good afterwards.
Hi, I'm Chris O'Brien, CEO of AdhereTech. I have two things that are not on my LinkedIn, and none of them are as funny as the gnome, but the first one is, it looks like my first job was at Bell Labs, but in fact it's not the case. My first job was a ski instructor for children in Vermont. And before that I was in philosophy graduate school, which I luckily escaped.
Thank you each. I think the gnome story is really fun and interesting. I've always loved the gnome.
Good taste.
Thank you. So let's begin with Mark. Mark, it's a long journey from when a company is conceived to sitting here on the stage today. Tell us about your company, which you joined as CEO, and what mindset permeates your company and how you attribute your success and link it to mindset.
So we are Cecelia Health. We are modernizing virtual specialty care. We've been expanding very, very rapidly, and I'll say the mindset that has carried me forward, not just at Cecelia Health, throughout my career, has been, I'll borrow from your UK roots, keep calm and carry on. Kind of a better twist on just GSD, which also is good, but I like, that's the carry on part, but keeping calm. A lot of things going on in life, and it's easy to get spun up. But you don't also have to spin up your emotions to go along with it. So
that's great advice.
That's mine.
Thank you. Wendy, tell us about the mindset within your company's ecosystem.
Sure. So we're MUTU System. We are an online platform for postpartum recovery and rehabilitation. And I think probably the most important thing that we do mindset-wise, that is from where the company came from in the first place, is an absolute focus on the end user. What does she need? There's so many things that get distracting as an entrepreneur, as a business owner, whether it's team or shiny things and investors and lots of people that you maybe want to please or impress or say the right thing to. At the end of the day, only one person matters, and that is the end user of your product. So that's sort of very key for us and the filter through which we run everything.
And that has been part of your company since its founding, that commitment to the customer, your clients?
Absolutely, yeah. Well, the company came about from my own experience. So my own experience of traumatic childbirth and not having the tools that I needed, even though I was, at the time, a certified trainer trained in postpartum recovery, and realizing that what I'd been taught to teach wasn't enough and didn't work. So it came from, I was that first user. I created what I needed and what wasn't available for me. And we try and keep her, we just call her, she's always in mind. If we're not helping her, if we're not making that experience easier, then we're not doing our job. Nothing else matters.
So Chris, your customers are on, I believe, the other age of the age spectrum. Tell us about your company and tell us about the mindset that permeates your ecosystem.
Well, at AdhereTech, we have a connected health platform that monitors medication behavior in the home. We do that with smart devices, things like smart pill bottles, pill caps, that can remotely sense how a patient is using their medications. And what's really important about that, and I think for a lot of us that have come up through technology or health tech, we don't realize how difficult it is for patients to adopt new solutions. And I think the principle of simplicity is one that's really guided AdhereTech from the very beginning. There's nothing our patients have to do to be in one of our programs except for to use a different pill bottle. All they do is transfer their meds into it once a month, and that's it. And so because of that, there's no internet connection, and there's no Bluetooth syncing, none of the things that you have to do to adapt most solutions, and it's much better for patients. We get very high adoption rates, very high retention rates, because it's literally as easy and no behavior change.
Thank you. Tell us about the connection between the mindset of your team and the patients that you serve.
Oh, was that? Sorry. Well, again, you have to meet patients where they are, and I think that's one of the things that the health system does not do well at all. And so figuring out what someone's issue is, why didn't they take their meds yesterday? Well, there's a lot of very human reasons why people don't take their medications. It's not just, I forgot. Well, my husband lost his job. I'm worried I can't afford my meds. Did you know we have a free drug program? I'm started having side effects. Well, let's adjust your dose. Let's take it at night. I mean, there's the stories you hear from patients, there's a million reasons why they don't do the things that they should. And unless they are speaking to them in real time, you'll never hear those stories.
Thank you. Mark?
Oh, you want? So, I mean, I think in terms of, you heard keep calm and carry on. For Salvo Health, I think it's like, are there any Glee fans? Remember Don't Stop Believin'? I think as a startup mindset person, you need to have that don't stop believing. It's going to be a roller coaster. I've led 5 startups over 24 years, and it's another month, it's another threat to your business, right? And you have to keep calm. You have to keep the focus, as Wendy mentioned, on what you're doing and what your mission is. For us, we talk a lot about the internal culture matching what our patients need. So we do gut health, and for there's 60 million people in this country who face IBS and GERD and celiac and dyspepsia and other GI and gut disorders, and they don't get great support between appointments, and that's what we provide: nutrition, psychology, cognitive behavioral therapy, therapeutic alliance, all that. But we have the saying, be whole for the sake of others. So we have a whole patient approach, and we ask each other in our culture to be whole, to bring your whole self to work, to think about each other as whole people, because you have to mirror in your internal culture what you want to deliver for your users, whether it's the doctors or our end users. So I think that kind of sense of respecting the complex and being whole, that is another big piece of our culture, and it's how you have to hold on to that mindset.
Thank you. So you've been involved with 5 different companies. Tell us about, if there are any, differentiators in mindset in your 5 different settings, and maybe there's been a common theme also.
Well, if I look back over a common theme in a lot of startups, I think I always tell entrepreneurs, usually you start a company because of a personal experience, Wendy's personal experience, right? You have some mission, and I always ask people to keep their eyes open, because it could be that you've solved a bigger problem than you realize. But you might have to go about it differently. My first company, we did last-minute travel deals, and that's a company that got acquired by Travelocity. But we couldn't get enough people to our website, but we ended up realizing that our last-minute travel deals and our technology were useful to 30 other big companies, from Travelocity to American Airlines and like. And so we became a $150 million company in a year from nothing, using that B2B distribution. It was a great product, but we didn't have distribution. I think that's how I think about healthcare. Oftentimes, a lot of companies in my vintage started out doing D2C health, and then we realized we had patient engagement. We had this incredible digital user interface. We had these multidisciplinary care journeys and personalized care journeys. We were doing all the things right. And now we're out talking to hospitals and health systems and large GI practices about distributing this better whole patient care through them, because they have millions of patients. And so it's kind of keeping your eyes open. You may have solved a bigger problem that may solve a problem for others as well, and your original go-to-market may need to adjust, but your vision had integrity.
Thank you. This is a great segue, talking about growing a company at that scale in that short time. So one of our panelists is going to tell us about an expansion, a substantial expansion of their company about to happen. And in the negotiations, tell us how, Mark, how mindset played into that.
Yeah, thank you. So again, we are a virtual specialty practice, endocrinology, nephrology, pulmonology, cardiology, and focused on patient access. It's a very personal experience since we're telemedicine. We're literally where people are, and oftentimes in their home, which is a very sacred environment. And we've been focused on how we can expedite and make a much more elegant and seamless transfer from primary care or care management teams into virtual specialty care. There's been a 19% increase since 2018 in referrals to specialists. And so it's an increasing challenge. There's only been a 2% increase in population. And there are a lot of reasons why primary care is referring to specialty more often. Many of them good reasons, many of them more challenged environment for primary care in general. I'd love to say it was more utilization of primary care. Anyway, as the market has evolved, we work with currently a patient panel of about 250,000 individuals across the country. That's soon to expand to about 1 million patients across the country, and we have about 4 months to get that up and running. And with a relationship with a large retailer, healthcare retailer. And so I can't say the name, but nonetheless, it is a exemplary of how the market is shifting. And so you asked, how do you keep calm and carry on in that one? The negotiation was very protracted. It is not easy, engaging. I think somebody had told us yesterday, working with the VA, the hardest part is contracting. This is not the VA, but the contracting process was probably on par through the different challenges and reviews and between security and compliance and everything else that goes with it. It takes a multidisciplinary team across the entirety of the company to make this happen and to make it happen professionally, and a lot of things are hurry up and wait. So when you're in the hurry up mode, keeping everyone calm and carrying on to deliver on what is the next right thing to be delivering. That's the same mindset, by the way, we bring to our working with patients. We just carry that forward across the entirety of the organization. Has a lot to do with communication and just staying calm through the whole thing. But there's always a lot to get done, and so you leverage technical tools to keep everybody in sync. We are a fully virtual company, so it's made, I think, a little more challenging being fully virtual to keep everyone aligned. But again, this day and age, there are a lot of tools to help do that. And if you're focused on the mission, and everybody that we've hired in the company is focused on the mission first and foremost, they're committed to it. You'll ask, later on we'll probably talk about bedside manner, but that's one of our primary things that we hear. Of course, clinicians bring bedside manner in the hospital setting. Why shouldn't we bring bedside manner to everything we do? And so that goes hand in hand with our keep calm and carry on mindset. So that's how we do it. That's how we're going to get it done.
That's just a terrific insight. Thank you for that. So many of us in our careers and in our lives have had mentors or experiences that have really helped shape our mindset. And so I'd like to invite each of the panelists to reflect on a mentor or an experience that really influenced their mindset outside of StartUp Health, because part 2 of the question, we'll go back and ask each of the panelists about the impact of StartUp Health on their mindset. But we'll start with Chris. Just tell us about someone in your life or some experience that really helped shape your mindset.
Well, I have a somewhat different answer to that. I in an earlier life, used to work a lot with the Mayo Clinic, and one of the founding figures there was Sister Nun. And her saying was, no mission, no money, no money, no mission. And I think it's really inspired me to think differently about life in general, but especially around healthcare, in the sense that we all got into this business, probably not because we thought it was the fastest way to make money, but because of the mission and the moonshot we're trying to achieve. Yet at the same time, aligning incentives across every player in healthcare that you want to work with and making it work economically for them is absolutely essential to achieving any goals and to getting to any kind of scale whatsoever in the marketplace. So that's really stuck with me.
Thank you.
No money, no mission. Mission.
I fully concur with that. Wendy?
Yeah, so I've always worked with coaches, a coach or a mentor of some description, and I would definitely say that that person has changed and evolved. Not that person, I mean, they've been different people. Because as you go through and as your business grows and as you evolve and grow from a personal development point of view and from a business success point of view, you need different things. You need different mindsets for the rooms that you're going to be in. And I think something that affects a lot of people is that issue around imposter syndrome, as it's known. And that was certainly something for me that in the early days, a good mentor and coach and mastermind and colleagues around you really helped me to, you do belong in this room. which is hard when you start out and you don't necessarily feel that maybe you belong in certain rooms. You think everybody else is cleverer than you, everybody else has it all figured out. They don't. You will mess up over and over again, and you can guarantee that everybody else that you're talking to will also have messed up. So it's just, that's how we learn, that's the journey, it's not failure. And that for me was a lesson that a mentor taught me very early on.
Often it takes that person who's on the outside and kind of looking into your life to give you that insight and the confidence to have a shift in your mindset and be more successful and more confident. Thank you, Wendy.
Yeah, so my dad was a doer. He was a surgeon, and I remember very clearly. I was the son that was supposed to go into medicine, so he would drag me into this. You could do this back then. He would drag me into the OR, so I could observe and just watch what happens. And this was a long time ago. But as I was watching and observing, I think he was hoping I was going to get hooked on medicine. And I partly did, but mostly I was observing all the chaos that was happening around all of that. Even though this was back in the 80s, it was probably even more chaotic today than it was back then, but it was pretty chaotic back then. And for him to watching a surgeon at work in the OR, navigating and working with all the support structures around him, all the materials, the machinery, the apparatus, the information flow, everything, I was observing that. And that what led me to get the business bug. But watching as that patient, I remember one patient who was crashing, just watching the calm and the directness, the getting things done as quickly as possible in that moment. And yet, after saving that patient, to then turn around amid all that, post all that chaos, to then turn around and sit down with the family and update them in such a calm way for what had just happened, and to give them hope and faith that recovery was going to happen. I mean, it's just it was just very life-forming for me, and so I go back to that very often.
Yeah. Thank you for sharing that.
Hearing you, Mark, tell that story made me think also of growing up with my dad, who was the chief of staff of a hospital, and seeing the chaos. And I remember that as a kid. And also being so conscious that the doctors had such great bedside manner in that age, and yet when they went home, because I grew up around doctors, they didn't take care of themselves. Like they were terrible about their own health. And unfortunately, my father passed away young, and so part of Salvo Health, it was very much about trying to take that whole patient person, and that a lot of traditional doctors look down on, because it was all about pharmaceuticals and medications and procedures, and bring the best of science and medicine combined with this kind of whole patient thing. But I have to add, my mentor was an incredible co-founder of my first company, Michelle Peluso, who's actually now president of CVS, and we started a company together. And we were 29 at the time, and it was 1999, and she showed me how you could care about every single person in your company and know them and build a non-hierarchical culture where good ideas could come from everywhere. And really, because our first jobs weren't like that. We'd each worked in companies where we were like peons, and we were just resources, not people, and not professionals to be groomed. And so every company I've been in since then, like transparency, every person good ideas can come from, treating them like adults. That's just been a hallmark of that kind of non-hierarchical, purpose-driven culture. And I learned that from her. And so that's something I carry forward.
Thank you, Jeff. Thank you to all of our panelists. Those are really terrific insights. Now what we'd like to explore for just a couple of minutes is your relationship with StartUp Health, and what lessons you've learned and what relationships you've formed that have helped you to continue the transformational mindset that you need to be able to ride the waves of entrepreneurship. We'll start with Chris.
Well, I think one of the great things about StartUp Health is really just the peer relationships that form with the companies that have gone through the program. And I think we're all trying to change the world and change the healthcare system in our own ways. And just hearing everyone else's stories about what works, what doesn't, leveraging the contacts they have has really been invaluable to me.
Thank you. Wendy?
I would also say it's around the peer relationships and other experiences that you get to share and are shared with you, because I think we all think that the problems or challenges that we face, we're the only one to have faced them. And when you're in a group of people that have been through what you've been through and are approaching challenges in new ways and different routes to market, etc., then you've always got that experience to draw on, which is somebody else has been there before you. So I think for me, it's around the ideas and solutions that others have already paved a path for you, which can make an obstacle or a barrier fade away, that you actually find is perfectly get-aroundable.
Thank you.
I agree that the support structure is phenomenal. There's a concept they use, circles, which is a small group setting of 8-ish people, CEOs and founders. And I have to say, these individuals now are some of my best friends. In fact, some of them are standing back there. Guys, it's just a phenomenal support structure. It helps you realize that where you think your problems are unique, your challenges are unique, they're not, and others have been through it. And when your batteries are low, they're there to bring you up, and you hope to be, and you want to be accountable to them as well, to bring them up when they're inevitably going through their mood swings of entrepreneurship. So that's, for me, that's something that's really unique to StartUp Health.
Thank you.
And for me in the founding of Salvo Health, StartUp Health had a huge role because even 10 years ago, Steve and Unity, who founded StartUp Health, were saying to me, hey, we need, in healthcare, we need medical experts, we need regulatory experts, but we also need people who are digital natives to come and build great patient experiences and that can scale services. And so they kept encouraging me to come into healthcare, and I kept saying, but I'm not from healthcare. How, and I think that combination of like digital first experience and scaling, to when I was CMO of Travelocity to 11 billion in sales, combined with recruiting the best doctors and recruiting the best academic researchers, was what made Salvo Health able to build really engaging experiences. So our patients open the app 6 days a week on average. They message us 10 times a week. We give them an interdisciplinary personalized care plan, which is a whole tech stack orchestration that we built. And that was, bringing all these new things. And that's why over 97% of patients with severe symptoms in IBS and GERD and celiac and dyspepsia after sort of 6 to 10 weeks on our program feel materially better. And that's like after 3 to 10 years of chronic symptoms. Because we built the technology to engage the patient in a personalized way and respect the complexity of these chronic conditions. And so that's that mixture that StartUp Health encourages of medical and academic expertise with digital expertise that's creating transformation.
Well, I'd like to thank the audience for joining us today and thank each of our panelists. I am always in awe of successful entrepreneurs who are improving the health of every person on the planet, and really appreciate your insights, really appreciate your comments and your thoughtful responses. So please give a round of applause to our fabulous panel.